So our patient care committee, first off, is a contractually guaranteed committee. It cannot be shut down by administration. I've been in committees where they ran the show and they basically, if they don't like the direction it's going, it's just, oh, we're not going to meet anymore. Well, that can't happen. This is actually contractually guaranteed. So there are 6 people from the employee side. Then there's also half a dozen members from the administrative side. We approach things in that committee pretty collaboratively. We do everything from here and work with the clinical ladder for registered nurses so that we can acknowledge nurses who do exemplary things, go above and beyond. It results in some sizable increase in their compensation. We also talk about staffing. It's a standing monthly agenda item. We figure out where things are in the various departments. Are there vacancies? Do we need to be doing stuff? In addition to that, we also just basically anything that's coming up that is impacting our patient care. We'll have conversations if there's going to be construction or renovation and we're going to have to shut down a hallway or shut down certain areas where we're doing patient care. It helps us to prepare for these things so it's not just dropped on us from out of the sky. And we get a chance for our staff, our members, to actually have input in what goes on. One of the contractual things that we have is Article 17X. What it allows us to do is to negotiate wage increases when we can see that that's the problem with our ability to recruit and retain staff. Well, in the patient care committee, working with leadership, we're able to identify these positions and that the wages are actually a problem. But we're able to identify these and work together to take a joint case to the corporate representatives so that we can work to increase wages. Perfect example that we had that we're identified, and it's a work in progress, but we're on it. Having trouble recruiting operating room technicians right now, scrub techs. And the manager of surgical services identified that she had actually had an interview for one of the vacant positions that's been on the boards for, oh God, 8 or 10 months now. And the person was very excited to be there. However, she decided to turn it down when she realized she'd be taking a $15 an hour pay cut. So we flagged that very quickly as one of the ones to put on our agenda that we're now working with the employee labor relations at the corporate level, try to adjust those wages so we can actually recruit and retain the best and brightest.